Hello, today I would like to talk about mental health and treatment. So, what does psychological pain causes? When you experience psychological pain, you can get into depression, anxiety disorder, or panic attack, and many things that could harm your mental health. And traumatic experiences and life stressors are huge cause that you could have depressions and other things. Mental health is real, and if you know you have mental health issue, you should get help and get treated right away. Hong Nguyen and Amy Scott wrote it that when a child experiences a death in the family, there can be short-term mental health effects for the child. So what we experiences as a child is very important because it stayed throughout your life. And when you notice that it's still affecting your mental health, I think you should not ignore that. Instead, you should talk it out, and then you should seek medical attention if you need, or you can get a lot of help from counseling and also doing therapy if you need it. And some biological and cultural factors could be maybe comparing yourself with other people, or you can have disability that can make you that makes you feel low self-esteem. And also some cultural factor could be when people come to this new place, adjusting new life and new environment, and you are not an English speakers, that could be really hard for the family, for yourself. If you don't speak English, it could be really hard. Either you're at work, either you're at school. So Jolene Killeen and other authors wrote that panic attacks could be related to a general vulnerability that also increases risk for other psychopathology. So when one thing started, it can lead to one thing, and it can lead to bigger and bigger and bigger. So I think in the beginning, if you know that you're starting having that panic attack or having the stress, it is really important to know how to cope with that and how to deal with that step by step. And I think that's when your mindset is very important. So I would like to talk about how to get that help, how to get that treatment, how to put your mindset for that. Cole Christopher Robinson and his other authors, his friend authors, wrote it that risk assessment is critical to identifying individuals who are at risk for harm to self or others. Just as stated here, if you're in risk having that mental issue and need help, if you don't get treated, if you don't pay attention to that and ignore and keep going on, I think it could really put you in a dangerous situation. Also, you can also risk harm to yourself, like it says in the quote, and then it can also harm other people. So it is very important to get screen tests or see a doctor, talk to friends and family members that you know. And I think you should go out there and literally keep yourself healthy. And that is very important, that you put yourself first, treat your mental health and put that into priority, because it is important. And when it gets long, it can be lead into a dangerous situation. So when you see a doctor, get counseling, therapy, anything that can help you. And it is not shameful, because I have a friend that experienced that, and when she get counseling and therapy, everything was turned back to she got a positive result, and she was really glad that she talk with her counseling and her doctor. So I really encourage you to do that if you experience those kind of mental health issues. And physical activity is very important, and also your mindset. Keep a strong determination that you can overcome this. And a few things I want to remind you: mental health, it happens to all ages. It doesn't choose young, old. It happens to all ages, whether you're a student, a professor, whoever, because life happen, things happen in life, and you cannot get away with that. So it's when you know you need to be treated, don't wait for that before it's too late. You have a freedom to choose to be healthy. You have a freedom to choose to be happy. So I would like to encourage everyone to have that strong determination and choose to be happy. And thank you all for this. This is for today.